Welcome to Case of the Day. I did record this about 5 minutes back, but I forgot to put the sound on. So here I am again. That's the 11th case today, the beauty of Mars CT. It's a short one, it just shows us the elegance of this technique. So this patient had TKR 16 years ago and is now for revision. The x-rays are actually quite good. You see the osteolysis in the femur, the tibia, there's effusion, there's this MCL avulsion here. But the CT is shows all this so much better. That's from medial to lateral. So you see the osteolysis in the femur, the tibia, in the patella, and then this little break here along the posterior cortex of the lateral femoral condyle. And in fact, this osteolysis in the tibia goes from lateral to medial, which you actually see here posteriorly well. But see the areas of osteolysis, they're so much better seen on than on the X-ray, but also as compared to the MR, if it had been done. And you can see the avulsion here, and these areas of osteolysis more anteriorly. Effusion on the axial image, that's the patellar osteolysis, and then the areas of osteolysis in the tibia. So typically this is done with iterative metal artifact reduction, and it allows exquisite evaluation of the periprosthetic bone. And in fact, if MARS CT had been available before MARS MR got developed, predominantly to look at the hip for the metal on metal issue with the J&J prosthesis, we would be doing much more CT than MR. And except for marrow edema, CT has better detail than MR. Look at this one. So there's effusion, which you can see here. This patient had infection in the knee post TKR. But the area, there's no marrow edema now because it's quiescent, but the osteolysis here and the soft tissue here are so much better appreciated along the lateral aspect on the CT than the MR. Or this recurrent simple bone cyst with the metal. We know there's recurrence on the MR, but far, far better appreciated on the CT. And then this periprosthetic osteolysis is just exquisitely seen on the CT. So MARS CT is often as good, if not better, than MR. Of course, if we do both together, then we get more than additive information. That's my WhatsApp channel, and thank you so much for viewing this.